Greetings from KCIAPM. I'm Dr. Aditya Agnihotri, Secretary KCIAPM, and with me is
Dr. Ranjana is Ranade, member of Newsletter Subcommittee, KCIAPM.
Hello friends. It's very heartening to know that Path which is the official magazine cum newsletter of KCIAPM, an initiative by the Newsletter Subcommittee of KCIAPM, is already into its third volume. As a part of this, we've been interviewing senior pathologists who contributed to the field of pathology as well as to the association in a big way. As a part of this, today we will be interviewing one such legend. The senior pathologist whom we'll be interviewing today is a very senior army veteran and recipient of Professor P.N. Wahi Oration Award and Ernst Fernandes Slide Seminar Award, both from Indian Academy of Cytologists. He's also been awarded Brigadier M.M. Roy Memorial Award from West Bengal Association of Cytologists. He is also a great administrator and an able administrator, having served as Registrar of Shri Dharmasthala Manjunatheshwara University. He served as a president of Indian Academy of Cytologists and also is a founding member of Karnataka chapter of Indian Academy of Cytologists. He's also been a president of Karnataka chapter of Indian Academy of Pathologists and Microbiologists, that is our own KCIAPM, in 2016. He's also been a great mentor to many postgraduates. He's been a faculty in many national and international conferences and also served as a member or editorial board members of multiple journals. We're talking about none other than Lieutenant Colonel Dr. U.S. Dinesh. Sir, welcome to the meeting.
Thank you, Aditya, and thank you, Ranjana. It is indeed, I'm very happy to be associated with both of you and also the Indian Association of Pathologists and Microbiologists, the Karnataka chapter. And I'm been very closely associated in organizing many of their events, and I think this is a unique opportunity to be associated in this forum here.
Thank you, sir.
Thank you, sir. It's our great honor as well as privilege to both of us to sit with you today and to take your interview where we look back into your own scintillating flashbacks. I know your knowledge as well as skill, experience in the field of pathology is vast, and it's going to inspire many of the upcoming students, postgraduate students who want to achieve great in this field, as well as you have already given invaluable contributions to the medical field.
So throughout your distinguished career, as all the way from being an army veteran to an academic pathologist, you would have encountered many challenging cases, faced many scenarios, and you've seen firsthand the transition of pathology from what it was to what it is now currently. Today, we would like to delve into those experiences, capture your insights into that and the changing field of pathology as we speak.
So why delay? Let's quickly look into the beautiful journey of Dr. U.S. Dinesh, who is here today with us. Why not, Dr. Aditya?
Let's get started. So let's first begin with your professional background. Can you share a bit about how you came into pathology and what inspired you to take up the field of pathology?
Aditya, as what inspired me, the story is very different. In the sense, when I was studying up to my metric, I was always thinking that I'm going to become an engineer because my father was having a big engineering concern in Chennai. However, what happened and what changed my direction is, as soon as I finished my metric, I had been to Manipal for some social function, a wedding in the family, and there one of my cousins was in his medicine at KMC Manipal. So he was very close to me and we used to go everywhere, and he took me one day to the Department of Pathology, the museum. As all of you know, the best museum I think in pathology is in Manipal, and I think we should compliment and congratulate Dr. Ravi Kalarao for that fantastic museum. So when I went there, I suddenly found that it had imbibed an interest in pathology in me. I don't know how it happened, and immediately I wrote to my father, who was in Chennai, that I'm sorry, I'm not going in for engineering, I'm going in for medicine. So he was a bit flabbergasted, and he said, we belong to a community where we may not get a seat at all. And I said, no problem. I don't mind wasting some time not getting into medicine. And I took in the pre-university in Loyola College, the second that is biology subjects. And I tried for medicine the first year. I did not get, and I had to wait for nearly a year to get into the MBBS. So this was one of the factors. And how I got into pathology was, when I was studying my MBBS, one of the subjects where I used to always score very high was pathology. Whether it was my inclination, whether it was my interest, or the subject was easy, I wouldn't know. But I scored the highest in pathology, and I in college did get some prizes for that. And later on, immediately after my MBBS, I joined the army. And in army, after you finish 5 years, we have a course called the Medical Officers Junior Command Course, which has administration as well as academics. So 4 weeks of academic session we had in the Armed Forces Medical College, and believe you me, there also I did very well in the pathology subject, again scoring the highest in pathology there. And that is a turning point in the academic or our professional career in the army, when we are asked to choose if we are going in for a specialization. So my choices that time was, I had done well in medicine and I had done well in pathology. So when I went for the interview for my for my specialization, my choices were pathology or medicine. So what happened was, that time the seats in medicine were not there, so they offered me radiology. Well, looking back, I don't know why I did not take up radiology. Maybe now I would have been in a different sphere. Anyway, I'm not in any way unhappy about the decision which I took. I said I want to go in for pathology. So I took up pathology and did my MD pathology from Armed Forces Medical College. And there, my guide was Brigadier Banerjee, who was a very ardent, enthusiastic pathologist. He was that year had gone into administration, but his interest and love for pathology was such that when we were doing our course in Delhi, being in administration, he used to be in the army headquarters till about 5:36, and later on he used to come to our pathology lab in army headquarters, army hospital, and there we used to have slide sessions, and it would go on up to 11 o'clock. So that he was one of my inspirational models, where I said I must take up pathology and go in for pathology.
Okay.
So this is my journey into pathology and how I got into pathology, and initially into medicine and into pathology.
So, would you like to share any of those experiences or key milestones which shaped your career as a full-fledged pathologist?
See, I was talking to you about Brigadier Banerjee. He was a very soft-spoken person, and he had a lot of, he was full of pathology, and he was always, one of his interests was, he used to keep seeing the slides one after the other, maybe 200 slides at a go. And one thing which I noticed was, at no point of time would he enter any of his findings into any book or anything. Later on, he would sit and keep writing those reports one after the other. Maybe just see the form and come back. He was never, I would say that his memory power was so good that he would be able to recollect each of these slides. 200, I think, is a huge, I'm talking about not the slides, but the number of cases. So this was one thing again which brought about a thing in my thing where I should go in for pathology.
At any time you had some internal conflicts, like whether to choose stethoscope or microscope, or were you very clear once you lose, like radiology is not there, medicine is not there, and that's how you went into pathology?
As I told you, I left my choice of radiology in that time itself. However, maybe at times, sometimes when there were occasions, but I have never repented that no, I have not gone into any clinical subject, but I am very happy that I was in pathology. Let me just come out with one incident in army. I was in the United Nations force, what we call the UNOZOM, that was in Somalia, and we had established a field hospital in Somalia. And we had about the troops were about 5,000, and we were equivalent to many of the other country troops. There was one incident in the evening one day. We had a call from the American Field Hospital. It was one of the biggest hospital where those days, I'm talking about 90 to 93, it was 1993, when they had a field a CT scan, which was very surprising. We had not even probably heard of them those days. And we had a call, and the we call the superintendent or the boss of the hospital as commandants everywhere in the army. So they also, the commandant rang up our commander of our hospital, saying that we want your pathologist and the physician to come over to our hospital to. So he asked why. He said, we want a patient who is suspected to be of malaria. So we were transported by a helicopter, taken to the American field hospital, and there we were taken to the patient, and we introduced to the patient. You see, there the patients are paramount and supreme. You have to be very careful with the patients as far as they are concerned.
Yes.
Unlike in our country, even in the army, it is an order given. Oh, come, lie down and all that. But there it is much different. So when I had the smear collected, and I saw the smears in their hospital, and it was falciparum malaria. So when we told them falciparum, they were stunned in the sense, oh, so fast and all that, and they were not even aware of how to treat malaria in those days. So our the physician, who is a good friend of mine, Dr. Sharma, immediately gave the prescription for the medicines and all those things, and later on again we came back to our hospital again in the chopper. In those days, it was something unique that it was there. So that was another thing which really made me decide that yes, we are a country, and probably we are seeing much more of our experience is much better, and far better than many of the other European and American nations.
Sir, how did your army experience help in your day-to-day pathology practice?
Well, the army life was, what we used to always do is, see, one is army, as you know, that discipline is one thing. So every day in the morning, if 8:30 was the time, by 8:20 I'm there. And at that time, all your slides, everything are ready for the day. So you start off your day seeing those slides, seeing whatever is required for the day. So once you start your day very early, you have the whole day at your disposal. Later on, you want to go to the library. Later on, you want to discuss with people. Later on, you want to go to the wards. You have a lot of time available to you. So this was one of the very important things which I have been continuing everywhere. Even when I have come to SDM here, I have ensured that 8:30 means it is 5 minutes before. And what happens, good thing is, everyone starts, once the boss comes, everyone knows that yes, he is itself there, I am there. So this is one of the important things. And another thing in the army, like how I told you about Somalia, I have been doing so much of FNACs of the liver in Somalia, because liver diseases, especially CA and cirrhosis, was very common, and I have done so much of FNACs while in Somalia. So this is one opportunity that we got to see the number of different types of cases that were available.
Sir, as we mentioned earlier, the pathology is changing rapidly as we speak. So how do you stay abreast with the developments in pathology now?
How do we stay abreast? I don't think there's any problem in staying abreast, because right from beginning, I've always been advocating that the books and the journals, these two things are very important. I think that is what keeps one going. And again, I go back to Brigadier Banerjee, who was my mentor as well as my guide. He always used to tell us, you see the slides, you do everything, but every day at least half an hour to 1 hour spend on your books and on the journals. Of course, now we can add these days. Those days we did not know anything about computers, we did not know about internet, but nowadays you have the internet. So that is another thing where one has to be abreast. And another thing being abreast is I always like to move with my juniors. And I always say that it is not me who is teaching them, it is they who are teaching. So many times I do come across these juniors who say, "Sir, it is in this journal, it is in this journal." And I say, "Please give me those journals or give me those books." So that is another thing, mixing up with your juniors is going to really help in your advancement of knowledge. Knowledge comes from everyone, and you should not stop at a particular person or at a particular time.
Thank you, sir. That's a wonderful message, actually. Everybody should learn from that.
Yes.
Sir, you covered almost 4 decades in pathology. Which areas do you specialize in, and what drew you to that particular specialization?
Yes, Aditya. The field where I was most interested, or I directed myself towards, is cytology. And what drove me to cytology was two things. Again, Brigadier Banerjee, he was of the time when there was no FNACs and all that, and he always used to tell us, you take any tissue which is coming fresh, put in a needle into it and see those lines. And he also used to do it. And the other factor which really brought me into cytology is late Dr. Satyanarayana. He was professor in AFMC Pathology, and he was also the secretary of Indian Academy of Cytologists and past editor of both your Indian Journal of Pathologists and Microbiologists, as well as the Indian Academy of Cytologists. And he was a very ardent cytologist. So I was quite friendly to him, and he told me that, Dinesh, go in for cytology. Because cytology those days was a field where many did not venture. And in fact, many of the senior pathologists were very apprehensive and were not very happy with cytology. They always do, especially with FNAC. So they should, no, you cannot go in for. So this was probably a challenge which came up to me, and I said, yes, I will go in for cytology, and it has helped me, especially with being very friendly to Dr. Satyanarayana. Unfortunately, we lost him, and otherwise he would have come up a very big way in cytology. The other question probably you asked is why?
What drew you to?
Yeah, this was one of the main reasons. Having got into cytology, I went into the administration of cytology in like the association,
Yes.
the Indian Academy of Cytologists, and I really worked very hard in the academy to ensure that we cytologists have a name in our country, of course, as well as abroad. And we did a lot to ensure that this thing. And I think presently, if you really see, our cytologists are renowned amongst the cytologists all over the world. And I have taken part in many of the conferences, CMEs, and workshops throughout the world and in India.
And our own Karnataka chapter.
Oh, yes. I'm happy that there are people that it is still functioning, and it is going to be in a big way going up in India.
Yes. Would you like to share any challenging case, one challenging case that you encountered and how you actually approached it to get the correct diagnosis?
See, where I think I'm personally involved in this case, because it was a very close friend of mine, an army colleague who was a colleague in the medical college also. So he had come with some sort of a lump, a vague lump in the abdomen, where people told him that no, it may be this, it may be that, and it got prolonged, the diagnosis. So then he just talked to me. I said, why don't you have a needle FNAC done? So he said, that naturally he was not from our field, he was from the community medicine. So he said, I don't know, I'll ask the clinician. So when he went to the clinician, they said, no, we may not be able to, it's not going to help and all this. This is quite about, I think, nearly 10 years back or more than that. So then I spoke to the surgeon because I knew majority of the people. So I told him, why not we do? He says, no, sir, this may happen, that may happen. I said, nothing is going to happen, we'll do it. So I think initially it was not under ultrasound guidance. So we put in a needle, and it turned out to be that it was a soft tissue sarcoma, probably a leiomyosarcoma. So then they were not very happy with it. They said, no, it may not be that, it may not be this and all that. I was insistent. I said, no, it is this. He said, no, this, it may not be malignant. Ultimately, I was a bit insistent, being my own friend and a very close colleague of mine. So then they operated, and it, there was a delay in it, and unfortunately, it was a rather big, by the time they could operate, it was a very huge mass. And then when we did then it turned out to be a leiomyosarcoma only. And then he went in for uh, the complete surgery. It was removed, and then he went in for radiotherapy and all those things. And he was okay. He was there for about 6 years or something. And unfortunately, after that, he had a pleural effusion. And again, that pleural effusion was this thing. It was the deposits of the same sarcoma. So I, being very closely involved with him and being a very close friend of mine, I thought this was a challenging case, and I always remember it. And I have presented it in 2, 3 forums because it was a good case. See, unfortunately, what happens? We call cases good, but unfortunately, it is not good for the patient. I always tell my students.
For us, it's bright, and for them, it's very dark. Yes,
so this is what I always tell the patient, students. Whenever you have anything malignancy, think twice, think thrice, always ensure that is it going to be someone who is very close to you. Every patient has to be close to you from the point of view. So consider a diagnostic dilemma also as someone who is close to you.
So talking about diagnostic dilemmas, gray zone forms a very important part of cytology reporting. And when we are reporting even now, or you might have encountered several situations where there are diagnostic disagreements with your fellow colleagues. But how would you handle a situation, and how would you advise the youngsters handle such a situation when they come across one?
These problematic cases where you're in dilemma, one always can go to your seniors, your colleagues, and your friends elsewhere. Like very recently, just about 10 or 15 days back, there was a problematic case. So I just had spoken to someone, and immediately, as soon as my number was there, the other person on the other side said, Dinesh, what is the problem? No, don't worry, you just send the slides and the block. We will look into this and we get back to you. So it's a question of communicating. If you always think that you are within your own world and you don't want to look beyond, then it's a problem. But you should always have that feel free attitude that I can always approach anyone. Maximum, what are they going to say? No, I don't have that. But hardly anyone does it. It is the communication and how well you are with people that matters.
The two important messages I take out from that. One is to set aside the ego while reporting and involve your colleagues in the discussion while signing out cases. Second important message is to be part of associations, interact, attend conferences so that you can build your network and so that they can help you out in the diagnosis every time as a second opinion whenever you are in need.
I totally agree with you, Aditya, especially the point that you brought out about associations.
Yes.
Right from beginning, I've always been advocating, telling my juniors, be part of an association. In fact, at times I was a bit strict in the sense that as and when people pass out from here, I give them 2 forms. The Indian Academy of Cytologists and the Indian Association of Pathologists and Microbiologists. You please become members of this. So some of them hesitate, but I tell them, doing something for your profession is hardly going to cost you something. You become a life member. Nowadays, I think it's not even reached 10,000. It is only less than 5,000. I always tell the juniors, you become a part of it and try to go everywhere, because each thing you hear from the specialists, you see something new, and that may rather imbibe some knowledge into you, as well as you inculcate the idea that yes, I also, many times you feel, oh, this is something which I've seen it, but I'm not projecting it. That is how it is.
So speaking about associations, you've been a past president of KCIAPM and you've seen how KCIAPM was then, and you've seen the transition till now. So what is your opinion about how KCIAPM has transformed itself and how we are doing the kind of work that we're doing?
Firstly, Aditya and Ranjana, I should compliment and congratulate both of you, the youngsters, how you have grown up in pathology and how you are ensuring that the association becomes vibrant and visible. And another thing which I wish to bring out here is, if you really see the Indian Association of Pathologists and Microbiologists, yes, it is the parent organization, but many times the way the Indian Association of Pathologists and Microbiologists, our own Karnataka chapter, has grown, there is not going to be very far when we are going to outgrow the Indian, and I look forward for it, not as a competition, but as something that one will always look forward to.
It's, I think, because of the support we are getting from
From
all
the-
the senior office bearers and founding members. It's truly, truly invaluable, sir.
They've truly set aside their ego and allowing some youngsters to take over and run the association, and supporting them, standing like a pillar behind them, is what's made this transformation possible.
I have one crib on this, Aditya. You see, it is not all the past presidents and the past office bearers who take part. I always keep saying that there are office bearers who, once they finish their tenure, think that no more are they to be associated, which I think is a very wrong thing. It is not only here, but in any association where I have been associated with, I always make it a point to ensure that I am actively involved. But I don't poke my nose too much into their involvement. I may be acting as a mentor, I may be as a support, I may be there for guidance. But this has to be there.
Because the experience matters a lot, sir, in guiding the youngsters.
Yes, you're very right.
It really
You're very
helps.
right.
As you said, your Somalia experience where you actually diagnosed falciparum malaria and you're very happy. Till date, we believe that yes, light microscopy is gold standard in diagnosing malaria. With the innovation of the technology and digital pathology, how it has actually impacted your pathology practice as a diagnostician as well as a very enthusiastic teacher,
So you're asking me two questions: as a diagnostician and
as a teacher.
as a teacher. Yes, it has really changed a lot. But at the same time, it has eased our teaching. In the sense, when I came to this place, SDM, there was not much of teaching that I had done, and I took it up as a challenge. And one thing I always ensured was, every time I take a class, there will be no repetition of that class. In the sense, if a topic was, I used to take liver, the next time whenever I used to have a class, I used to ensure that I do not take that particular topic, for my own interest, that I learn new things. And of course, your PPT presentations and all that, I did learn only things. I am not, otherwise, earlier I was not computer savvy, but now I am very savvy, in the sense I utilize them to the maximum. So, as far as teaching is concerned, it has really done a lot, especially even on slide seminars and all those things. It has really helped. And presentations. Earlier, we used to have photography also.
Yes.
I still have those slides of my this thing where it was such a big burden for
Dissertation special needs.
for me as well as the photographer. You had to be called, and he used to say that okay. But now there's nothing. You hardly spend any time. You hardly require anything in that. So that is one thing. As far as diagnostic requirements of digital pathology, yes, like as I told you, the question that you asked me earlier was in dilemmas.
Yeah.
The digital images can immediately be sent, and immediately you can communicate with them. You go back to the specimens, you can send the specimens digitalized and all that. Of course, there are a lot of things to learn in it, how much we know about it and how much is it really going to go ahead in it. That is a problem. And many places, and the cost is one thing. That is the biggest problem in any of the things, because everyone would like to have digitalization. In fact, I think the NMC also has said everything should be in digital forms. But it is such a costly thing. I think once the cost comes up, everything would be in place, and we would be certainly much. But the modern innovations, modern technology has really improved and brought about a lot of change in the pathology.
So
especially
from you, it's a
molecular.
welcome sign.
Yeah, it is certainly a welcome sign.
So, any particular technology that you're particularly excited about?
See, I have been reading about liquid biopsies, and I have been trying to inculcate this into some of the juniors. Of course, now I'm not probably much into all these things, having become a Professor Emeritus. So I am trying to tell people, let us go in for these newer technologies, especially in this field of cytology. Well, let us go in for where we are able to do better diagnostics, especially for tumor markers and all that. So I think liquid biopsy would be a very good thing as far as tumor diagnosis is concerned.
Okay. So, what are your thoughts on future of artificial intelligence in pathology? Do you think is it going to replace pathologists in future?
Reading much about artificial intelligence, we get scared.
True.
So one of the scare is, am I going to become redundant? Because my thing is redundancy does not matter. But I'm more worried about the future generation of pathologists. Because what is going to happen is, when you become a pathologist, one is, it is a career. You want to go in for a job. Maybe once artificial intelligence comes in, the requirement of a pathologist per se may become redundant, or the number may come down drastically. So that is going to be it. And secondly, how far is the artificial robotics going to completely replace? Is it possible? I don't think it is going to be possible. But yes, we have to be careful, and we have to ensure that we advance ourselves not in technology but in our own field of being involved physically and manually in diagnostics.
So that we can somewhere control that AI ultimately.
You see, nowadays what I am seeing elsewhere is many of the techniques which we learned in the good old days, people are forgetting them.
Yeah, true.
So the day is not far where everything is done by a machine.
Yeah.
And once that happens, what is the role of a pathologist? Rather, a technician would be able to do it better. And not only a laboratory technician, a technician from the one of any other technician who is good in his digital
Skills,
techniques
correct.
would be able to replace you. Maybe. We have to be careful.
One of the quotes that I read recently about AI mentioned that a pathologist will never be replaced by AI. They said, but a pathologist who doesn't know AI will definitely be replaced.
Yes, very
We should move with the times.
Yes.
In fact,
That's a fantastic message, sir. We should move with the time.
We cannot say, I do not know.
Yes. Yes.
See, even at this age, I don't mind learning new things. May not help me now, but at least I am keeping myself abreast with the knowledge, with the latest technology.
That's a fantastic message to the youngsters to stay relevant
Yeah,
in
you
all.
should.
Sir, you have had a long and very distinguished career in pathology. What message would you like to give to aspiring pathologists who are just starting out now?
The pathologists who are coming into the field should be dedicated, devoted, and they should get educated well. You should not come into pathology because you didn't have any other choices. You should be passionate about whatever you do. It is your choice. You should be passionate. And how you be passionate, there are various ways to get passionate. But be involved, be devoted, be dedicated, and always look up to people who are mentors. Learn from them, and also try to keep abreast with the latest, and don't be very myopic in your views that no, I will not go in for this. The field of pathology is vast. There is still scope for many people to come into it. So don't get disheartened if you say that, I got into pathology. Be passionate about it.
So, what do you enjoy the most being a passionate pathologist, and what keeps you motivated to have that passion life?
See, what is making me get involved and passionate about pathology is every day is a challenge in pathology. Even today, when we came across a case, there were 2-3 views about it, and I felt happy that everyone has his views, and then it gives rise for discussion. So the challenges in pathology, diagnostic challenges, are what we look forward to. As challenges in life itself is what makes us going. And as a pathologist, challenges in diagnosis is what keeps me going.
But it can't be all that rosy, sir. If there's one thing that you would like to change about pathology, what it would be and why?
It is a very difficult question because I have traveled 40 years in pathology. So now if you want me to say one thing which I want to change, what I would like to change is the way we teach pathology. Because earlier, we talk more about postgraduates. They were always involved in diagnosis at every level. But now what we see is, one is that hands-on training is slowly being lost. Not only the hands-on training, the tendency for them to learn in the sense, because everything is available digitally, so nothing gets into here. It is all from your mobile, your laptop, or anything. So probably artificial intelligence also, they may be able to say that this is what the diagnosis is. So one thing which I want to change is the way the teaching is being done. We must go back to our olden days of putting them through. It should be through the whole course with hands-on working. That is very important, which I think is being lost. So that is what I feel should change.
Very true. It's like assessment drives learning. For that assessment, you need to make students receptive and make them work
you should,
and interact
because
with teachers. Correct.
That is what is lacking probably nowadays.
Now, into the last segment of this interview, that's going to be rapid fire. It's a short question with one word answer, sir. Are you ready?
Yeah, I am ready.
What's your favorite organ system?
I think the soft tissues.
What's your favorite branch in pathology?
Cytology, FNACs.
What's your favorite stain?
I would always call it Leishman, Romanowski.
Oh, what's your favorite cell?
Since we are talking about Leishman, the robin blue cell that we see in squamous cell carcinoma.
Wonderful, sir. Lastly, what's your favorite book in pathology?
I would say DMA Cytology, FNACs.
Wonderful. Amazing, sir.
So that was amazing, sir. Now we'll move into a segment which is known as this or that. I'll give you two options and you'll have to choose one. Are you ready, sir?
Yes.
Doctor or colonel?
Colonel.
Administration or academics?
Academics.
Books or online material?
Books.
Traditional microscopy or whole side imaging?
Traditional.
Cytology or histology?
Cytology.
Thank you, sir.
Good. Thank you so much, Ranjana and Aditya. It has been wonderful being associated with you earlier, but in this new role of yours, I really enjoyed being with you today. Thank you.
Your
And
journey
wish you all
was
the
so much
I think the journey will inspire
yeah.
a lot of our members. Any message that you would like to give to all KCIAPM members out there who are going to be watching your session now?
The only message which I like to give them is ensure that you grow in the institution, in the association, and your growth in the association will ensure that the association grows. And always understand, individuals don't matter, the institution or the association matters.
Very true.
Long live the Indian Association of Cytologists and Pathologists, Indian Academy of Cytologists, and our own KCIAPM. Jai Hind, Jai
Thank you,
Karnataka.
Thank you, sir. That was a wonderful message. It was great having you here for this session of interview. And there's a lot of things, new things that everybody would be learning from you, especially from your life experiences and how your army life helped into your pathology practice and how you continue to inspire next generation of pathologists and giving them the right message going forward. Thank you, sir.
Thank you. Thank you so much, sir.
Thank you. It was wonderful.
Thank you, sir.